Okay, guys. Tried to do this a while ago, but got busy doing other things. So, not quite sure who's already with us here. Charlene, thanks for joining. So, for those who don't know me, San Diego 619, Jim, thanks for joining. My name's Sean. I'm an acute care nurse practitioner. Been a nurse for a decade. Thought I'd talk a little bit today about nurses and providers. And I use the term providers because I don't want to use the term physician or doctor because I'm a nurse practitioner. So there's more healthcare providers out there besides physicians now. There's nurse practitioners, there's nurse midwives, and physician assistants, and the like. Flavy 1504, thanks for joining. Talking about a urban, I can't even call it an urban legend, talking about a fact about providers being so rude, so mean, and so nasty that they actually make nurses cry. I've been a nurse for about a decade now, so this is thankfully getting better. But at one point in my career, I don't know what NTGM means, Flavy, sorry. I'm new. You're going to have to type some of that out, my friend. Physicians were known to lead with a heavy hand and, well, hello. Lead with a heavy hand, meaning that they barked orders, they screamed, and they yelled. I have been part of and experienced on my own, as well as other nurses have experienced, providers who have been not so nice, and so not so nice that things get thrown, things get broken, turns into a high school environment where the person who doesn't get their way is a little bit of a spoiled brat and lets everybody know. And I say person because it'd be men and women, both male and female providers. I keep saying providers because it's more than just doctors. Because they don't agree with or they want to establish their alpha presence by screaming and yelling. The problem with that is that it creates an environment that nobody wants to work in. So my little chat today is about how nurses should not allow a hot-headed provider to make them so upset that they cry in front of that provider, because it's actually happened. Shustov, thanks for joining. It's actually happened, it happened years ago, and it's actually happened recently to a couple co-workers of mine months ago, maybe, because the provider was not happy with the outcome, not happy with their decision, not happy with something that had to do with the patient's care. And so this particular provider decided to throw a temper tantrum. Whoa, I don't really know who's giving me all the hearts, but thank you. Is there a way of seeing that? How do I see that? It's horrible. Still learning, guys, sorry. So the provider becomes a spoiled, rotten baby, and instead of talking it out, instead of Esmond joined, you guys really need to get like full names or something like that. So can't even pronounce some of these user IDs. The problem is that the provider should talk with that nurse or that other care provider. Casual nickname. Mine or yours? So instead of it turning into a backyard high school playground, it should be an environment where the healthcare providers, all members of the team, should be able to speak freely without any kind of, it's a mix of my name and surname. All right then. Well, good job. Well, welcome. Thanks for joining. Talking about not nurses not crying in front of a provider. Orlov's smile. Welcome. I am a nurse practitioner. I'm an acute care nurse practitioner. I've been a nurse for a decade. Talking about how sometimes providers, and I say providers because it's more than just physicians, that providers can be mean enough and nasty enough that they would actually upset nurses so greatly that the nurses would cry. And the nurses would cry in front of the provider, which is what I'm talking about, is that if a nurse is that upset, whether they're upset in an angry manner, upset because they're offended, upset because they feel mistreated, everybody deals with it differently, but if you have to cry, don't cry in front of the provider. Don't cry in front of the patient either. There's going to be disagreements, there's going to be challenges, there's going to be right and wrong when it comes to caring for your patients. I think that in the end of the day, the provider who signs their name on the chart, and in this case it's usually the physicians, when the provider signs their name on the chart, the provider is completely responsible for the care that is provided to that patient. But they cannot do it alone, and they should not bite the hand that feeds them. Thanks for joining LK11. Is it an L or is it an I? I think it's an L. Welcome. So far in my career, in the 10 years I've been doing this, it's happened about half a dozen times. It hasn't happened to me personally, but I've witnessed it on numerous occasions from other nurses. I've also heard of horror stories from other nurses. There's been horror stories of surgeons throwing instruments across the OR table, throwing instruments into walls. I know of 2 particular incidences where someone was so upset that they broke a computer screen or broke another piece of equipment. And in all cases, it shows your true colors, that we, as adults, should be able to communicate with one another, regardless of how we feel about each other personally. We should be able to communicate with one another in an effective manner that doesn't involve screaming, yelling, like the high school playground. Not even high school, right? Elementary school playground. I always use the analogy of we have to play nice in the sandbox. That sandbox will differ depending on where you go, but we all need to play nice in the sandbox, because at the end of the day, it's not about me, it's not about you, it's not about who was correct or incorrect. It's about the patient. It's about the best care for the patient. And that we as providers, healthcare providers, nurses, and the physician providers, as well as nurse practitioners, that we can make mistakes, that we are human, and that we should not feel afraid to make a mistake and to have repercussions for the mistakes we make. We do deal with life and death, but we should not be afraid to do our job because we're afraid of upsetting someone. Short and sweet. It's talking about providers and nurses and their working relationship. That there should be no nurses crying in front of providers in any way. If that is happening to you in your workplace, then it needs fixed. It needs addressed. And if it can't be fixed or addressed, then maybe it's time to go looking for a new job. Thanks for tuning in, everyone. And I don't have anything to say other than this was short and sweet. Just wanted to get on Periscope and scope a bit today. So, busy day today. Interviews, all kinds of other stuff. So, drop me a line. Hashtag AskTheNP. AskThenP. Can't even spell. And drop me a question. What do you want to hear? Thanks for tuning in. Peace out.